Hello, welcome to today's Insta Live with you, Andreia Trigo as usual, and I will be joined by an amazing doctor from IVF Spain Madrid, Dr. Katharina. So I'm going to invite her to join us here today, Dr. Katharina, and we're going to talk about something really important. We're going to talk about when to seek medical help when trying. And why is this important? It's important because most people wait longer than they should when trying to conceive. And on average, it takes 7 years until couples, or the average amount of couples, gets the baby in their hands. So we need to find a way of helping people identify the right time to seek medical help. That's what we will be doing today with Dr. Katharina from IVF Spain. We'll tell you all you need to know about how long you should be trying to have a baby naturally, what are the signs, what can happen if something gives you an indication that you should be trying or seeking help sooner than average, and how can you get ready for that first appointment. So let's see if we can get IVF Spain to join us. You don't want to miss today's Insta Live. Let's see if we can get Dr. Katharina to join us here today. And thank you so much, everyone who is joining us. And as I was saying, did you know that it takes on average 7 years? Hi, Dr. Katharina.
Hello, Andrea. How are you doing?
I'm okay. How are you?
I'm fine, thank you. Greetings from Madrid.
Greetings from
Good to meet you.
Thank
Can you see me well? Do you hear me well?
Yes, I can. Thank you so much for taking the time to talk to us today about such an important topic. I was reading, I was actually watching a presentation at ESHRE earlier in the last year, and on average it takes about 7 years until patients get a baby, and that's because people try to conceive for longer than they should, and then it takes a long time until they are referred to the specialist. So it's really important that we are here today to talk about when to seek medical help.
Yeah. Yes, I think so as well. It's important because we normally wait too long. That's right. In our daily practice, we notice that there are only few patients who arrive in the clinic too early. It's never too early, I think, but sometimes you can tell them, okay, just wait a little bit more, wait, maybe you get pregnant. But mostly it's not like this. Mostly it's just like the other way around.
Yeah, so it's rare that people go to the doctor earlier than they should have. It's usually been longer than they should have. And how long should people try to conceive naturally? Is there a time limit?
Well, it depends a lot on the characteristics of the couple, but like general information, if it depends a lot on the age of the female, of the woman. In women younger than 35, we tell them if they have been trying during 1 year to achieve a pregnancy and they don't conceive it, then it's like the moment to start doing the exams. Meanwhile, you're still trying. And then if you don't get pregnant after 1.5 years or 2 years, you should start doing treatments. Older than 35, we give the same indications, but with 6 months earlier. So we recommend to start doing the exams after 6 months of regular relationships and not achieving the pregnancy, and then start doing treatment like after 1 year.
And so before 35, we can try to conceive for a year, and then we should seek help. After 35, we only need
1.5 more days. No, there's half a year. Sorry, 6 months.
6 months, exactly. And if there are any signs or symptoms that there might be a problem, so let's say I'm under 35, but I have irregular periods, or I have other risk factors, would that mean that maybe I could seek help sooner?
Exactly. So if, for example, you don't have regular cycles, or you have endometriosis, or you have fibroids, or you had like infections, general infections, something like this, or surgery, abdominal surgery, then maybe we could already start after 6 months for searching. So if there's something that makes us think that there is a reason for not getting pregnant, then we should recommend 6 months.
And Dr. Katharina, I don't know if you find that in your practice, but it looks like women are told that having painful periods is normal or heavy periods is normal. So those signs that could potentially tell us that maybe we should seek help sooner, a lot of women are told by society that those things are normal, so they don't seek help. Can you give us maybe some of the signs that would say, well, maybe you should seek help now?
So, well, the painful bleedings, of course, can be normal, but they can also be a sign of, for example, endometriosis. Endometriosis affects the ovaries, can affect the ovaries, can affect the uterus, can affect general abdominal cavity, and it can affect fertility. It might not be like this, but it can be. So if you notice that you have very painful bleedings, or that you have pain with your sexual relationships and so on, then I would recommend at least to go to a gynecologist to make a checkup in order to see if ultrasound you see anything that is like strange. If everything is normal, just take the painkillers and try to, or take anti-baby pill if you're not interested in being pregnant. Another sign of possible problems of fertility can be changes in the rhythm of cycles. So, for example, if you have been if you have had regular cycles during all your life, for example, every 28 days, and then the cycles start to get shorter, this can be a sign of that your ovarian reserve is getting lower. This is also like a sign to go to a fertility clinic, or at least to the gynecologist, to an ultrasound checkup, in order to see if everything is right. These are like the most common signs, like changes in the kind of bleeding. Can also be like if you start getting a very, very less like a very low menstruation, only like 2 days of bleeding or smear bleeding, changes in the length of the cycles, or changes in like painful menstruations.
And so those are some of the signs and symptoms of female fertility problems. There might be a problem. And is there anything that we could look for in our partners, in men? I think it might be a bit more difficult, isn't it, to identify?
It's very difficult. If you have, the only thing is that, for example, ejaculation problems, then you can go to a urologist to check if there is any reason, if there's, for example, any neurological reason. But or you just do a checkup and go to a clinic to do a spermogram. But for just of clinical signs, it's very, very hard to know. And then
Yes.
The only thing maybe is appearance of varicocele, like testicular swelling, something like this. But it's very, very rare. Yeah. Normally, it's easier in the female, and also in the female, it's not very easy. Just from clinical science to know about fertility.
And if a lot of women are already tracking their cycles in some way, either with LH strips or with temperature, if they notice, for example, several LH peaks or no LH peaks, or for example, that the temperature is a bit all over the place, would that give you also an indication that they need further investigations?
Yes, it can tell us this. The temperature measuring is very difficult because normally you have to be like very strict in doing it. So you have to do it in the morning before you get up every day at the same hour, and so on. So you have to have like a really regular life in order to do it well. But you can try to do it if you see that it's not regular. In case of doubt, it's always better to go to a clinic, to ask, to check yourself, and not to have the surprise later on.
Yeah. And when patients decide that maybe something might not be quite right, I think I need help, who is the first point of call? Would that be the general practitioner, the general doctor, or should they go straight to a gynecologist, a fertility specialist? What should they do?
Well, the ideal way would be to go to the general doctor and then to the gynecologist, and then, if necessary, to a fertility clinic. In practice, at least in Spain, the general doctors, first, they don't have so much time in order to attend you well, and second, most times they don't know too much about fertility.
That's true.
It's unfortunately it's the same with a lot of normal gynecologists.
Yeah.
It can happen that you go to a normal gynecologist who's maybe a little bit older than average, and he does an ultrasound checkup, and he just sees that there is no tumor in the ovaries and that there are some follicles, and then he tells you, okay, everything all right. But he doesn't do it well. He doesn't count the follicles and so on. So it depends a lot on the gynecologist. The doctors in the fertility clinics, we try to make aware our colleagues of these problems because it's a very common problem. Infertility is getting much more frequent now. To make them be aware of it, to make them check it more, to also tell their patients to be more aware of it, to go to clinic earlier. But most times, right now, the best way I think would be to go directly to a clinic to do the checkup.
I think you're right. From my experience, I think a lot of general practitioners even tell patients, you're still young, continue trying, or they don't know how to interpret some of the hormonal tests.
Exactly, they do them in the wrong moment. They do FSH and LH screening like in the 10th day of cycle, and it's not. It can't tell us anything. So.
Yeah, and it's part of the problem because it then delays, and age is probably one of those factors that we know that matters a lot for fertility.
It's. I would tell you. It's what most matters, the age.
So if our patients go straight to a fertility specialist, what can they expect of that first fertility appointment? Are there any specific exams that the woman and the man have to do? What can they expect?
So normally in the first visit, first of all, we talk. First of all, we talk a lot. So we ask the patients of the fertility history, how long they've been trying, if they notice anything, any change in their lives, what medications they take, their allergies, and so on. We also try to talk about way of life because it's also important. Then normally we do like a general anamnesis about all medications they take, about operations they've had, and so on. And then normally we explain like the basic exams we have to do on the male and on the female. We always have to check both of them. And then it depends a lot on the age of both of them, on the age and on also on how long they've been trying. Normally we tell them, we tell the male to do the spermogram, so the sperm analysis. In a lot of clinics, they can even do it in the first visit, or we tell them to come a couple of days later to do the sperm, to leave the sperm sample. For the female part, for the woman, we mostly do an ultrasound in the first visit. So we ask them if they had the last menstruation, and then we do directly the ultrasound. We try to count the antral follicles in order to see the ovarian reserve. Maybe we also see if they are just to be ovulating. Then I tell them, okay, you're going to ovulate in 2 days, so just try in this cycle, things like this. We can check the uterus in this moment. And after this first visit, well, we also speak about the different possibilities of treatment. So this depends a lot on the age and on how long they have been trying. If the patients are young, we tend to at least explain treatments with IUIs. If patients are over 35, if it's the part is over 35, normally we directly tend to go to IVF treatment. And then, well, we explain the treatments, we explain the pregnancy rates, and then we ask them for the rest of the exams, which is mostly blood sample. Because the ultrasound, you can do it direct in the first exam, then you do the blood sample, and sometimes you also check the tubes, but not in every patient directly. And it depends a lot on the patient profile.
So to clarify, patients should expect a long consultation, that first consultation.
Yes, normally it's about 1 hour to 1 hour and a half.
And
Depends, no, more or less 1 hour.
so they should expect also a lot of questions about their sexual life, about their menstrual cycles.
More than sexual life, it's like the general way of life.
Yeah.
And also like the illnesses they have, if there is family history, things like this.
Yeah. Is there?
We also have a lot of time, like for questions of the patients, because these kind of treatments are new, so you have to explain very well in the beginning.
And for the male, then he will do the sperm analysis. Will the man also have to have a physical examination at that point, or only if the sperm analysis is abnormal?
Normally, we just give the sperm analysis. We do, well, before doing this, we have to check, we have to do a blood check. We check HIV, hepatitis, and syphilis, so the sexual transmitted diseases. This is just for laboratory security and also for in order to know. And if everything is fine, we get the results 20 minutes later, so it's very, very quick. And then he does the sperm sample. The sperm sample as well, you can have the results in the same day. So the biologist afterwards prepares the sperm sample and then checks the 3 parameters, the most important parameters, which is the number, the mobility, and the morphology. And it's like the big checkup.
And for the woman, so she would also have all the same questions, and she would have the ultrasound scan, the gynecological examination.
Yes, we can also do the pap smear. If she hadn't had one recently, we normally every 2 years. Here in Spain, I know that in the UK it's normally every 3 years. So UK patients, for example, we tell them, okay, every 3 years it's fine. And then often we also do directly mock transfer. So we try just with the catheter to go inside the uterus in order to see if the cervix is permeable, if there's any problems for doing the transfer later on.
Okay.
But of course, this is also only if the patient wants to do it. It's not obligatory. Same for the ultrasound, but most of them say, okay, let's just do it and do the checkup.
Yeah, it's best to know if something is wrong. Yeah.
Exactly. And once you're inside the clinic and you get to know the treatments and the pregnancy rates and so on, most patients afterwards are okay. When can I start? Because they see that that there's a possibility to get pregnant.
And how quickly will patients have a result of all of these tests so that they can make a decision on the way forward? Is it on the same day or is it a few days later?
Normally it's like a couple of days later, because the blood sample goes to the external laboratory, and it's like 3-4 days later we have the results. It's very quick. So what we normally do, if patients want to start like really quickly, is do the first visit to do all the examples, and then have a second first visit like for the result, checking the result. And this visit we normally do some days before the menstruation. So we redo the ultrasound checkup in order to see if there is everything right, and already tell the patient the treatment plan, explain the medication, and so on.
I know that at IVF Spain you treat a lot of patients from different countries.
Yes.
How are these first consultations happening now during the pandemic? Can patients do some of it remotely, or how does this happen?
Yeah, right now, because of COVID, we do a lot of online consultations. Mostly we do it per Skype. We can also do it per WhatsApp, like a video call per WhatsApp, or simply a phone call. In this first visit, we explain the patients, and then afterwards they can decide whether they want to come to Madrid to get us to know us personally, to do all the checkup here, and it's all done in one day. And then like start with the treatment, or whether they want to do all the exams in their home country and then send it to us per email, have the second visit also per Skype or WhatsApp, and then come for the treatment. Before COVID, we did more first visits on site in the clinic, and it was easier to do it like this, because they just came here, did all the exams, and then came again for the treatment. But now we have to do it like this, and it's okay.
Yes, and I think we're all learning different ways of working as well, and at the same time still allowing our patients to get the treatment that they need, which is so important.
Exactly. And most important, I think, is we have seen that patients can still come to do the treatment. So they can come for doing, for example, egg retrieval, embryo transfer, all this they can do without any problem. We normally do like a invitation letter in order to be able to come to Madrid. Most of them don't have any problem. And what we also have seen, and this is very important, is that the pregnancy rates didn't change.
Yeah.
So although it's more difficult for organization, pregnancy rates didn't change. So we still work the same, we are the same stuff. It's only like a little bit more difficult because of COVID, but we can still get there.
I think we've all learned from almost a year ago in March, when all the clinics had to close. Now they're allowed to remain open because we have safety measures in place that make it safe. We know that it's very unlikely that the virus can be harmful for the baby or the mother. We don't know of any bad consequences that can happen from it. And I think all the countries are getting better at testing as well. So we can test before we go and still travel and make it really safe for everyone.
Exactly. So, now for coming to Spain, you need the negative result 3 days before. So it's supposed that everybody that is on your same plane is negative. So it should be safe.
Absolutely.
And same in the clinic, because we're continually testing everybody. So
you're also tested negative. So you're treating patients.
So testing like every 2 weeks to all the clinic staff. So, and of course, if you have symptoms, you stay at home. So.
Absolutely. And Dr. Katharina, how can patients who are listening and saying, maybe I've been trying for more than 6 months or 12 months, maybe I have some of those symptoms, how can they get ready to seek that medical advice so that when they get to that first appointment, they already have some of that information that you want from them.
Yeah. So the most important information for us, like for the first visit, is how to know about the sperm quality and ovarian reserve. Okay. So and the uterus, these three things. So for the male, if he can have a spermogram done before the first visit, perfect, because this gives us already information. Normally, spermogram, we recommend to do it in a fertility clinic, but you can just call, make an appointment, and they will tell you how many days of abstinence they recommend. Normally, it's maximum 2 or 3 days. Okay. And for the woman, what we normally recommend is to do the anti-Müller hormone, the AMH.
Yeah.
You can do it in any day of the cycle. It's just a blood sample. And then once you have this result, we already know we have an orientation about the ovarian reserve. Later on, the uterus we can check in the first visit, because we can check it with ultrasound. And the second part of ovarian reserve we can also do in the first visit. So if patients can come to the consultory with a spermogram done and an anti-Müller hormone done, perfect.
Brilliant. So for those who have joined, I want to just make a short summary. When to seek medical help. If we are below 35, we can try for 12 months, but then we should seek help. If we are over 35 and a half, we should try 6 months and then seek help. But there might be certain symptoms that tell us that something might be wrong, in which case we can seek help sooner or straight away. Some of them are irregular cycles, painful cycles. You mentioned as well previous abdominal surgery. As well.
Exactly. Yeah. The most important is like infections. For example, if you have an appendicitis or like some bowel infections, something like this.
Yeah. In men, I think the hernia repairs as well can lead to obstruction.
Yeah.
So any of those signs would tell you just seek help straight away. And the first point of call often is the GP, but they sometimes don't have the knowledge to support you or to signpost you quickly enough. So it's best just to go straight to the fertility specialist. And for that appointment, it's important that both partners attend the appointment, because they will be both assessed.
Exactly. It's the ideal is that both of them come to the first visit. Sometimes it's only the woman who comes, but normally both of them assist. It's like the ideal, because you also explain the different types of treatment, and then it's easier if both of them come there, because it's a treatment for both of them.
Absolutely. And if they want to take some information to that appointment, it would be useful if they already had a sperm analysis, and for the woman an AMH test. That would also be useful as well.
Okay.
And they can expect a long conversation in that first consultation that goes from questions about their general life, maybe a lot of things that they didn't know would be related to fertility, about their family as well.
Exactly.
And then the examinations, just to check if there's some sort of problem that might be preventing it. And then you mentioned that you talk about already that could be either intrauterine insemination, in vitro fertilization. So you talk about the options, but then it takes a couple of days until we have all the information to make the decision on what actually to do next.
Exactly. There are some patients where it's like easier to give them the direction, which is like more to egg donation treatments, for example. But mostly it really depends on the age, on the ovarian reserve, on the sperm sample, and so on. we have to do a personalized treatment. You can't just tell, okay, you do it like this and everybody does it like this. It has to be personalized.
Absolutely. And we mentioned as well that treatment is still possible even with the pandemic. There's a lot of measures in place. And for patients who, well, I'm going to leave this video on IGTV, for patients who want to get in touch, how is the best way for them to reach IVF Spain or IVF Spain Madrid? Is it through Instagram, or is there patient consultations? I've seen on your Instagram that your next consultations are fully booked at the online ones. So how patients...
One in February, yeah, one German and one English patient meeting, exactly, but it's normally it's full very quickly. They can contact us on any way. They can contact us on Instagram. They can contact us on our website. They can call us. If they call and they want to talk to an English-speaking person, they will be directly transferred to someone who speaks English. The same for German, the same for French. And then we can also do free consultaries out of the patient meetings. So you just tell us, and we do the Skype conference or per WhatsApp, as I told you, per phone. And we also try, of course, to do the personalized treatment also with patients who live abroad.
Dr. Katharina, thank you so much for joining us today. I think it was so good to clarify when should we seek help, what signs and symptoms could mean that there is a problem, and what to expect of those first consultations. It was a pleasure to speak with you today. And for anyone who's listening, do get in touch with IVF Spain through their Instagram. You can also find IVF Spain on our Enhanced Fertility Program app, on our website, and do check them out. There's a few clinics around for IVF Spain. So you have Madrid and Alicante as well.
Yes, and San Sebastian in the north of Spain.
Exactly. So there's lots of them to choose from, but always the same amazing level of care. Dr. Katharina, thank you so much for joining us today.
Take care. Bye. Bye. Bye.